Opening up the waiting room.
Everyone, welcome. We'll begin in just a few seconds as we let everyone come into the room and connect to their audio. All right. Good afternoon, all. Welcome to today's best practices for reopening, preparing for yellow tier. This event is hosted by the Office of Economic and Workforce Development and produced by the virtual outreach team of the COVID Command Center. Please note, San Francisco is not in yellow tier yet. Some housekeeping for today. Language interpretation is available in Cantonese and Spanish. To enable language interpretation, click the interpretation icon and choose the language channel that corresponds to your needs. Recording. Today's event is being recorded and streamed live on Facebook and YouTube. Audio and video. We respect all participants in this convening today and want to create a safe space for all. By default, all participants will be muted and video is disabled. Video will be on for speakers only. For chat, to participate in the chat, please select the chat button at the bottom of your screen and send any questions to Q&A, Catherine Daniel. Get tested, San Francisco. You can save lives and stop the spread of COVID-19 by getting tested through your healthcare provider. If you have symptoms or have been exposed to COVID-19 but don't have health insurance or can't get tested through your provider, visit sf.gov/gettestedsf or call 311 for information on getting tested at a city-run testing location. A safe and effective COVID-19 vaccine, coupled with continuous preventative measures, are our best tools to end the COVID-19 pandemic and safely reopen San Francisco. Vaccines are free for those who live or work in San Francisco. Go to sf.gov/COVID vaccine for information on eligibility, vaccination sites, including locations, and links to book an appointment if available. The Together We Heal campaign was born to protect the African American community and their unsung heroes from COVID-19. This campaign is the brainchild of the San Francisco African American Arts and Cultural District and the Joint Information Center, and has been supported by Mega Black. The campaign uses art to reflect the vibrancy of the African American community. It also shows that we can be protected if we all follow the health orders and listen to the advice of the health officials. This campaign stretches beyond the African American community. It embraces people from other cultures, safeguarding all who live, work, traverse, and visit neighborhoods with people of color. When we work together, we can heal together. Together, we heal. We recognize that there may be members of the media joining us on today's webinar. We will be prioritizing questions from businesses and members of the public during the Q&A. Media are welcome to follow up with additional questions that they may have at dempress@sfgov.org. Today's agenda is as follows, and now I'd like to hand the floor over to the Acting Director of the Office of Economic and Workforce Development, Ann Topier. Ann, the floor is yours.
Thank you so much, Elisa and Nick and the entire virtual JIC team for producing this webinar, and welcome to everyone who is joining us here today. I am Ann Topier, the Acting Director of the Office of Economic and Workforce Development. I am pleased to once again be able to co-host today's webinar in partnership with the Department of Public Health so that we can provide all of you with a reopening preview in advance of our anticipated move into California's yellow tier. We have been hovering just at the threshold of yellow for several weeks, and I know that this is a much anticipated move. As with our last several webinars, we aim to give you as much information about our current public health status and what we expect will reopen once we move into the next year. This transparency in the city's decision making and our commitment to offering as much notice as possible so you know what is coming and have time to prepare has been a key priority for OEWD and the mayor. And we have had a fantastic public partner in Dr. Phillip and the Department of Public Health in supporting our goal. Today, we finally find ourselves in a place where we have renewed hope for our recovery. San Francisco has been outstanding in managing the virus and minimizing the devastating consequences that it brought to so many communities. Our vaccination rates are unparalleled in major US cities. I do not want to understate how difficult this past year has been or the difficulty that COVID has created, but I am so proud of where we are, and I'm grateful for the commitment and partnership of our business community in coming together to protect our city and withstand this last year. As I'm sure most people on this webinar are aware, we have waited several weeks to be in a position to move into the yellow tier. Our cases are very low, but the trend has been mostly flat rather than declining. So it took us a while to meet the criteria to move to yellow. Dr. Phillip will share specifics, but I think this underscores the need for people to be vaccinated as soon as possible and to continue to practice our safe behaviors. Often, our business community can reach groups that government cannot. So please help support the case for vaccinations and responsible actions like mask wearing and physical distancing. COVID is not gone yet, and in order to keep moving toward reopening, we must keep our case rates down. This webinar is largely focused on the reopening activities, and I will hand things over to Dr. Phillip for a full presentation of what we are expecting. I do want to share some key updates that support reopening as well. First of all, Muni is working to continue expanding their services. We are looking forward to the reopening of the subway and most of the rail lines over the next month, and will continue reopening bus routes throughout the summer and into the fall in order to close service gaps as businesses and schools begin to reopen. As many of you know, the city launched the street crisis response teams earlier this year in order to effectively and appropriately respond to individuals experiencing both homelessness and a behavioral health crisis. These teams have been very effective and add an additional compassionate tool to the city's ongoing strategy for caring for our residents and maintaining public safety. That combined with the police department's community ambassador program, providing supplementary presence in key areas within the city, walking down our streets feels safer and cleaner. You can see and feel the difference. Over the last year, the city has advanced new initiatives aimed at reducing rigid processes and requirements that limit the ability for businesses to start, operate, and expand within the city. With tools like Prop H, the Small Business Recovery Act, and the Shared Spaces Program, businesses can approach reopening and the new normal with much greater flexibility and support from the city. For our part, OEWD continues to make as many resources available to businesses as possible. Right now, because of $10.9 million in funding that the mayor recently announced, we have 2 grant programs open and accepting applications through next Friday, May 7th. The Small Business Storefront Equity Grant, focusing on industries that were most impacted by the health orders and businesses that have not been able to access other funding. And the Community Storefront Anchors Grant, accommodating long-running businesses that contribute to the culture of San Francisco. Please find more information and apply at sf.gov/sf-relief-grants. We've included in the Zoom link, in the Zoom chat as well. Next week, the Small Business Association plans to launch the Restaurant Revitalization Fund to offer $28.6 billion in grants to help restaurants, bars, and other eligible businesses keep their doors open by reimbursing their lost revenue due to the epidemic. We expect that money will go fast, and I encourage you to go to the SBA, the Small Business Association page, to see a sample application and get more details about that program. Additionally, OEWD will be partnering with local agencies to help businesses who need assistance in applying. We're ready for this. And with that, I will hand things over to Dr. Phillip, the city's health officer, who will speak to our health indicators, our vaccination progress, and the activities that we expect to reopen under the yellow tier. After we hear from Dr. Phillip, Patrick Fosdahl from the Environmental Health Branch of the Department of Public Health will explain the city's enforcement of health regulations. After these presentations, we will have time for Q&A. Please send your questions through chat to Q&A for them to be answered live. Thank you, Dr. Phillip. It's an honor to introduce you.
Thank you so much, Director Topier. So nice to be with you and your team today. So nice to be here today with everyone. Thank you, Director Topier. Thank you so much to the Joint Information Center virtual outreach team again for helping host these really important conversations. And I'm so pleased to be able to be here. I know we're all pleased to be able to be finally at this point after so long of talking about yellow tier. As we have just heard, we are giving a preview, and we understand from your feedback that it is helpful to get this information as far in advance as possible. But having said that, we also have to say the caveats that this means that we're continuing to work on the revisions to the health orders. We're continuing to incorporate information from the state that changes day to day. And we do have to say that some of these things may change by the time we see the final order. So we do have to look at the final documents when they are released, but this will give us all a sense of how we've been thinking about our progress, and it is truly exciting. Next slide, please. And we can really see that progress as a city, as Director Topier was mentioning, when we look at our curve of cases. We see how far we've come from January when we had that really large surge. And now we are at a low and stable number of cases per day. And we're very happy about that. And this has continued despite our moving from purple tier to red tier to orange tier, and having all of the openings that go along with that, and having all of the increased activation and socialization that has come with the very welcome openings, the very welcome ability to increasingly see each other and do some of the things that we have missed. So that is a good sign. However, we have not seen the cases continue to go down. And so we continue to watch very carefully. We would be even happier if the cases were going down closer to zero. But we continue to keep an eye on these indicators as we continue to open. Next slide, please. It's very heartening also to see that not only our cases, but our hospitalizations have decreased as well and stay at a very low level. We have averaged about 21 patients in the hospital. And you see in January that high of having nearly 260 people in the hospitals in San Francisco with COVID-19. And so this is real progress, and this is something to be celebrated. We know that we can't take this for granted, as we all have heard many times, and we only have to look at the news from across the globe to see what's happening in India. We only have to look at the news from across the country and even up the West Coast to see what is happening in Oregon and in Washington, to know that now is not the time to let our guard down. So while we can simultaneously celebrate moving to yellow tier and everything that that represents in terms of openings, expansions, more opportunities to be together, to be within our city and doing the things that we miss and love, we have to continue the core principles that will keep us and our city safe. Next slide, please. And chief among these, as you've heard from Director Topier, is getting vaccinated. San Francisco, all of us residents here have done an amazing job of stepping up and getting vaccinated. So of those in San Francisco who are 16 or older, this means anyone who is eligible currently for the vaccines under the current FDA approval ages for vaccines, 70% have received at least one dose and 45% have completed their vaccination series. And this is wonderful, but we want this number to be 100%. We want everyone who can get a vaccine to get one and to want one. We have appointments available, and we encourage you, if you haven't yet, please do it. It is not only for your own health, it is for the health of our city and the health of our economy, quite frankly, because continuing to reopen and loosen and be able to come out from under these restrictions really depends on driving the virus down for good. And the way that we do that is vaccination. Next slide, please. So with all that, we'll move into some of the changes. And I know people are really excited to hear a lot of these. And some of these are very, very new and fresh changes. And so we have heard this week that CDC has relaxed the outdoor mask guidance that it provides for fully vaccinated people. And it recognizes both the power of vaccine to prevent serious illness and infection overall, and also that we know now that outdoors is so much safer than indoors because of all the natural ventilation. So the guidance now says that fully vaccinated people no longer need to wear a mask outdoors while we're walking or running or hiking or biking alone, or in our households or in small outdoor gatherings with others. Masks, however, are needed in some situations, including when in crowded areas or when we can't maintain distance of 6 feet between others and other households. We know that the state, the California Department of Public Health, will update their masking guidance to align with the CDC because we have heard that announcement from the governor and from the state health officer, Dr. Aragon. We in San Francisco and every other county have to operate within the state's framework and guidance. So we can't get ahead of the state. We do have to wait for them to implement the change before we can change here. We do anticipate that we will adjust our masking requirements outdoors to largely meet what the CDC says. Now, we do recommend that you carry a mask with you at all times. They're still required inside, and there's limited exceptions where they could even be required outdoors, as we said, in crowded areas. There are federal masking requirements for transit and while waiting for transit as well. So good to have your mask handy, but this is really welcome news in time for socializing through the spring and the summer, that we can be outdoors safely without masks in a lot of situations. Another incentive to get vaccinated. Next slide, please. We also know, and there's been a lot of focus on the fact that we have heard from the governor that the blueprint that currently exists at the state is going to be removed on June 15th. I really want to caution us to not think about this as a switch. It's really tempting to say, once June 15th comes, everything changes and we're able to go back to normal. But it is not, as we know, unfortunately, a magical switch that'll get us back to normal. We are going to have to slowly and gradually move towards reopening, because the last thing that we have wanted to do throughout this process, and we know that it has been challenging and frustrating to sometimes see the steady progression of loosening that we've followed. We do not want to have to roll backwards. And if we have any doubt that that's possible, we only have to look to our neighbors to the north, to Oregon and to Washington, where they're contemplating shutdowns yet again because of surges in cases and hospitalizations. We're waiting for updated guidance from the state. We know that they are going to retain some elements of their guidance after June 15th. We don't know yet which ones, but we will need to, again, adapt to whatever they have, and also figure out, as we always have, what is needed and what is necessary to keep San Franciscans and the people who come into our city safe. And we will continue to do that following the science and the data. But as you will see, as we're talking through our yellow tier guidelines and what we anticipate, we will do as much as we can to expand to meet whatever the state allows. And we are able to do that now more than we were in earlier tiers because of the low case rates, because of the ways in which San Franciscans have stepped up to prevent the spread of this disease. Our reopening is going to continue to be gradual, and we are going to have to watch our case rates, our hospitalization rates, and any new events that occur in regard to variants, in regard to any changes that might make us change our plans. But this is how we're planning for now. Next slide, please. So let's get to some of the specifics of the framework. And again, we are not going to be able to cover every single thing. Those will be detailed in the documents as they are released, but we'll give you a general idea for some of the changes that are coming. And this will not be comprehensive. We will focus on the sectors and on the areas that we anticipate having changes. So for now, as you saw from the data slides, we're winning the race, if you will, of vaccination versus the variants that might cause continued surges. For now, we can't be complacent. We have to make sure that doesn't change, because again, our goal, your goal is not to go backwards. And that is really what we're trying to focus on. We want, again, to continue to align as much as possible with the state's framework, with some additional specific safeguards in very focused areas to limit the spread of the virus in our incredibly dense urban environment. We continue to focus on expanding activities outdoors because, again, outdoors is much safer than indoors. Most of the yellow tier changes are expansions in capacity or easing of restrictions, but there are some new sectors that can open. And these changes will go into effect next Friday, May 7th. And this is in part because it does take some time to make sure that as we're removing a lot of the restrictions that we had that were San Francisco specific, that we are aligning these across our sectors and that we are aligning them with the state. And again, the caveat that these are not final until you see the official documents. They might still have to change. Next slide, please. So for dining, outdoors, face masks are not going to be required. The tables do have to maintain a 6-foot distance. Masks are still recommended for people who are unvaccinated and dining outdoors. If a person has to go inside the restaurant or inside any building for any reason while dining outdoors, like to use the restroom or to find a staff member, they must put on a face covering. So again, we want to keep those handy and on our person. Indoors, restaurants are open at 50% capacity, and there is previously had been a 200-person cap that is now lifted. Tables can now be comprised of up to 8 people. There is no household limit. And there can be buffet and self-service items such as sushi boats or frozen yogurt that allow for distancing. So the facility, the restaurant or the shop has to allow for distancing between patrons using those self-serve items, and a metering system has to be in place. Areas that promote congregating should be closed. Next slide, please. So for bars outdoors, it'll be the same as for restaurants. Face masks will not be required if the tables can maintain a distance of 6 feet. Masks are recommended for unvaccinated people, and instead of dining, this should be unvaccinated people in these outdoor bar areas. If you must go inside again for any reason, you have to put on a mask or a face covering. And indoors, it will now be, as a new sector opening, open at 25% capacity up to 100 people. We are going to ask and require that tables be used. People are seated for this first phase of indoor bars. Food is not required to be served. And wineries, breweries, and distilleries are open at the same capacity and safety rules as for bars. Next slide, please. So this is just want to show you this chart, and it can sometimes be a little challenging to know how things are organized. And so we hope this helps a little bit. But here are large organized gatherings. Here's a flow chart that we anticipate for yellow tier. First of all, is this a political protest or religious gathering that's happening? There are specific rules that are followed for religious activity or political activity, as they are constitutionally protected. And you can see those in Appendix C2, Section 9 or 10. If it is not either a protest or a religious gathering, then are there advanced ticket sales or defined guest lists and assigned fixed seats? If yes, then the question is, are the guests going to stay? Do they have to stay in their seats for the majority of the event? They're not mingling, they're not wandering. If yes, then this qualifies as the seated live event and performances with in-person audiences. If no, meaning that they are going to be mingling and moving about, then you have to follow the rules for conferences, meetings, and receptions. And if there are not going to be any advance ticket sales or a defined guest list or assigned seats, then this qualifies as a gathering that is a festival and follows those rules. And outdoors, that's 100 guest capacity, and must submit a plan, a safety plan, with a template that we provide to the Department of Public Health a week in advance. Next slide, please. So let's go through what some of those events then might mean if you use the flow chart and figure out exactly where your event or a event might land. For outdoor venues with events and professional sports with live audiences, the capacity now is 67%. That is the attendees only, subject to physical distancing rules between households. There can be sections where all of the guests or patrons are fully vaccinated, and that can also be in any suites, and that counts against the overall capacity limit, but there is not distancing required in those sections where everyone is vaccinated. The testing and vaccination requirements, there needs to be proof of a negative test or vaccination, but it's not required for events that have fewer than 4,000 people in the audience if face coverings can be worn at all times, so no concessions or food or beverages served, or fewer than 300 people where those events have food or beverage service. And then the fully vaccinated section, which we just mentioned, could be at 100% capacity as long as they are located at least 6 feet from any other sections, and they are subject to any other existing requirements as well. Next slide, please. So if you have the same types of events, but they're indoors, now the capacity is less, 50%, again, subject to physical distancing. And then patrons in any section where everyone is fully vaccinated and in all of the suites count against the overall capacity limit. The testing and vaccination requirements here say that proof of a negative test or vaccination, complete vaccination, is not required for events with no more than 300 people in the audience or up to 25% capacity, whichever results in the smaller number. If they wear face coverings at all times, so no food or beverages are served, or if there are fewer than 200 people in the audience, if the events do have food or beverage service. The fully vaccinated section in these events can be at 100% capacity as long as they're located at least 6 feet from the other sections. And an approved health and safety plan is not required if the events have no more than 300 people in the audience or 25% capacity, whichever is less. If it's more than that, then an approved plan is required. Next slide, please. So for conventions, meetings, and receptions, indoors and outdoors, and for example, this is a graduation reception or party. And remember, the definition that the state provides means that there's a guest list or ticketed sales, and there's assigned seating at this event. So for indoors, it can be up to 200 guests with face coverings at all times, except for food and beverage service, and distancing between members of different households. Again, continuing with indoors, all guests must have purchased tickets or have a defined guest list, and a seating chart or assigned seating is required. And any guest who's 12 and up has to provide proof of vaccination or a negative COVID-19 test within 72 hours of the event. This is a state rule. Outdoors, this can increase up to 200 guests and distancing between members of households, or up to 400 guests if proof of vaccination or negative COVID test within 72 hours is obtained for all guests. And if all vaccine eligible guests are fully vaccinated, then social distancing is not required. The same rules apply for purchasing tickets or having a defined guest list and having a seating chart or assigned seating. And then for groups between 201 and 400 people, they have to show proof of vaccination or a negative COVID-19 test taken within 72 hours before the event. Next slide, please. For festivals, arts, music, and theater performances outdoors, they're open for organized and supervised events with up to 100 attendees with face coverings worn at all times. Members of different households must maintain distancing. And if all vaccine eligible patrons are fully vaccinated, then distancing is not required. Next slide, please. So for fitness classes and for gyms and fitness centers indoors, Indoor gyms can open at 50% capacity based on patrons only. They are open for group cardio or aerobic classes at up to 50% capacity, no more than 200 participants total in the space, as long as all instructors and participants wear face coverings at all times and maintain distancing between households. A 6-foot distance between stationary equipment with implementation of the DPH approved ventilation measures. And in the prior bullet, we will confirm this, but our intention right now is to decrease that required distancing to 6 feet between households, between people that are in those classes or at those gyms. Saunas, steam rooms, and indoor hot tubs can open at 25% capacity with distancing. Face coverings in those settings are not required because of the dampness, and wet masks are not effective. Indoor swimming pools are open at up to 50% capacity. Next slide. So again, these centers and gyms are open with safety modifications, including distancing and cleaning by patrons in between uses per standards. Face coverings are not required if this is outdoors, where patrons can maintain at least 6 feet of social distance, and there is no special capacity limit. Next slide, please. So for non-essential office buildings, these are open at 50% capacity, but the state still has language, and we must follow this, that all workers who are able to telecommute are still encouraged to do so. Fully vaccinated workers do not count against the 50% capacity limit. Next slide, please. For retail and grocery stores and shopping centers, eating and drinking in stores, such as at a in-store cafe, is allowed per the safety protocols for indoor dining. For shopping centers, including enclosed malls, indoor common areas can reopen now in yellow tier, subject to face covering requirements and minimum 6-foot distancing between different households. Indoor food courts can open at 50% capacity. A DPH-approved ventilation measure and a system to monitor entry of patrons to the food court area must be implemented. Next slide, please. For film and media production, indoors and outdoors, it's allowed if the production is covered by the September 21st, 2020 COVID-19 return to work agreement. The production involves 300 people outside and 200 people inside or fewer in a single location, with testing and other safety protocols in place. Or 3, the production has an approved health and safety plan. Next slide, please. For indoor family entertainment centers, they are open at up to 50% capacity for naturally distanced activities such as bowling alleys, billiard halls, and indoor miniature golf. The requirement for vaccination or testing to increase maximum capacity from 25 to 50% is now lifted in yellow tier. And other family indoor entertainment, such as indoor arcade game centers, ice and roller skating rinks, indoor golf, and indoor playgrounds, can reopen subject to the required capacity limit and other safety protocols. Next slide, please. For hotels and other lodging facilities, limited size private meetings, conferences, and receptions are allowed per the capacity limits that we covered in previous slides. Indoor gyms and fitness centers may open at 50% capacity so long as personnel supervise their use by guests to help ensure compliance with safety protocols. Indoor saunas, steam rooms, and hot tubs are open per the indoor gym safety rules. And buffets and self-service items that allow for distancing are allowed, and a metering system must be in place. Areas that promote congregating or crowding should be closed. Next slide, please. For movie theaters indoors, this is 50% capacity based on patrons only, up to a maximum of 500 people. If a theater complex has multiple individual theaters, then the 50% capacity limit and the 500-person cap applies to the complex as a whole and to each individual theater. The 3 household limit for groups attending movie theaters indoors together is lifted. The maximum size of the group is increased to 8, consistent with indoor dining changes. Live performances are subject instead to the safety protocols for indoor live audience performance venues. Live performances, however, that are merely incidental to the showing of a motion picture, such as a talk by the film director, are allowed. Next slide, please. So for gatherings outdoors, including informal social gatherings, outdoor gatherings of no more than 75 people total, so long as individuals maintain at least 6-foot distance from members of their household, are permitted in yellow tier. Face coverings are not required, and food and drink is permitted. Unvaccinated people are urged to wear face coverings. The distinction between small outdoor meal gatherings and small outdoor gatherings without meals is lifted, as noted above. Next slide, please. So for small gatherings indoors, in general, small indoor gatherings at up to 50% capacity and no more than 50 people total with face coverings on, meaning no food or beverages, and distancing and ventilation measures are urged. These gatherings are still discouraged at this time, and for the most part, we really want people to be socializing outdoors to the greatest extent possible in accordance with the outdoor gathering rules. This recommendation, however, does not apply to fully vaccinated individuals. So we see on the right, for fully vaccinated individuals, small indoor gatherings in residences and other private settings with fully vaccinated individuals or individuals who are at low risk for COVID-19 may remove face coverings to the extent allowed under the state rules and in accordance with CDC guidelines. Yet again, another reason that vaccinated people are able to interact more safely in a variety of additional settings compared to people that remain unvaccinated. Next slide, please. So libraries can open at 50% capacity for counting patrons only and otherwise consistent with the safety rules for retail. Patrons can use computers for internet access subject to distancing, capacity, and other safety restrictions, and with regular cleaning of shared equipment. The San Francisco Public Library has announced plans for the phased reopening of in-person services at the main library and certain branch libraries, with curbside pickup and drop-off service at designated branches continuing. Next slide, please. So for other activities, adult daycare programs and senior community centers, they are allowed to operate at up to 50% capacity indoors based just on participants, not staff, and no more than 50 people total with face coverings on. So no food or beverage service, and distancing and ventilation measures are urged, consistent with the same safety rules that apply to small indoor gatherings. And employee break rooms are capped at 50% capacity. Employees may eat indoors per the safety protocols for indoor dining. Next slide, please. So thank you so much. And again, we may see some changes, but these in general are the ways that we are viewing our movement into the yellow tier. Our approach, as always, is to gradually release restrictions, to continue to watch our case numbers and our hospitalization rates. We hope that they continue to stay steady, or ideally would continue to go down as more of us get vaccinated. And it becomes so important, again, that we're all staying compliant with all of the health measures, the protocols, the restrictions. And so I want to now turn it over to my colleague from the Environmental Health Branch of the Department of Public Health, Director Patrick Fosdahl. His team plays a key role in ensuring compliance with our health orders, our directives, and all the regulations that are in place to keep us not only safe, but to keep our city moving forward towards continuing to loosen the restrictions that are necessary because of COVID-19. Thank you.
Yes, thank you, Dr. Phillip. That was a super encouraging presentation. We've been doing this for a while, and to see an first-time immunization rate hit 70% is super exciting. Good evening, my name is Patrick Fosdahl. I'm the Acting Director of the Department of Public Health's Environmental Health Branch. Just by way of background, the Environmental Health Branch is the regulatory branch for the Health Department. It's made up of about 30 different regulatory programs, which enforce the nearly 50 different health codes in San Francisco. When the COVID emergency was declared, we added the enforcement of the health orders and directives to that work we were already doing. Next slide, please. When the health orders first began to be issued, which has now been more than a year ago, we recognized that there were going to be two main components to health order compliance, and those are prevention and enforcement. There's an old doctor saying that says an ounce of prevention is worth a pound of cure. This also applies to health order compliance. The better job we could do at preventing violations from occurring, the better the compliance with the health orders was going to be. So we invested a lot of energy initially into education email blasts, phone calls, site visits, and webinars like the one this evening. And that was all an investment in that ounce of prevention. You could also see the enforcement tools listed there, and we continue to work very closely with the City Attorney's Office around when and how these are used. At the end of the day, these enforcement tools are applied when prevention fails. As the city continues to reopen, the Entertainment Commission is now responding to complaints involving their permitted venues, and DPH is primarily focused on our permitted facilities, which include the food and bar establishments. So between the two programs, we will continue to have a substantial presence in the field, including after hours and on the weekends. So as we reopen, please don't be fooled into thinking that health orders are not enforced after hours. They most certainly are. Along these lines, it is worth noting that businesses violating the health orders are also putting their other permits at risk, including those issued by the Alcoholic Beverage Control, or ABC, the Entertainment Commission, and shared spaces. And these can be difficult permits to obtain, so that's just a word of caution. Also, we will have Director Weiland from the Entertainment Commission here, who will be a part of the question and answer time at the end if you have questions specific to the Entertainment Commission and the venues that they permit. Next slide, please. When it comes to health order enforcement, we have set up progressive enforcement steps. If you're a business owner, we'd encourage you to just stay off the steps. This slide presents a very basic overview of the process. The first step is being issued a notice of violation. These notices let you know what violations were noted and what you need to do to correct the problem. These have a very short correction time, which is typically from immediate to less than 24 hours to correct. The second step is to issue a closure notice, which are typically for repeat violators. This requires the business to remain closed for up to 2 weeks or until the next tier, so it can be substantial. The last step is to issue a closure notice along with a fine, and the fines are up to $1,000 per day per violation, so they can also add up very quickly. Up to this point, we've primarily used notices of violation and facility closures to gain compliance. As I said earlier, we want to encourage business owners to just stay off the steps. If you've been issued a notice of violation, you need to redouble your efforts to comply with the health orders so you can avoid moving to step 2 or 3. Next slide, please. Up to this point, DPH has performed about 7,400 compliance inspections, and we've issued citations to around 2,000 businesses, which continues to be a violation rate of roughly about 25% of those inspected. So there's been a fairly high rate of businesses complying with the health orders, and this is something we would like to see continued as we reopen. You can see listed there some of the most common violations, and we are currently issuing around 2 to 3 closure notices to businesses each week. Next slide, please. As we look at the future and the changes coming under the yellow tier, we do have some concerns based on what we've been seeing in the field. As Dr. Phillip has pointed out, our biggest concern regarding the spread of COVID is overcrowding indoors. We've seen this primarily at entertainment venues and at bars and restaurants. We've also seen this happen at gyms and churches, so the risky activity can happen anywhere. If you're currently operating a business which has the potential for large indoor gatherings, we ask now that you spend some extra time putting in place adequate security and safety measures in order to ensure that the safety of your customers and employees is maintained. Please keep in mind that we will continue to have inspectors in the field, including after hours and on the weekends, and we will continue to document violations and take enforcement action when necessary. In closing, this past year, we've seen the city move from the yellow tier to the orange, then the red, and eventually to the most restrictive purple tier. And now we are on the verge of finally traveling all the way back to the yellow tier again. It's been a long and difficult year as we have all had to constantly make adjustments around the changing health orders and the color tier requirements. I know this has been difficult, and I want to express my gratitude to the overwhelming majority of San Francisco businesses that have cooperated and seamlessly made these changes as required. Your diligence is a big part of why San Francisco is now on the verge of moving to the less restrictive yellow tier, and everyone at the health department is as excited as you to see San Francisco moving in this positive direction. Having said that, as Dr. Phillips stated, we are not across the finish line yet, and this is no time to abandon what has gotten us this far. We can continue this partnership for just a little while longer. We'll shortly be able to reopen safely. Thank you again for having me, and I'm now going to turn it back over to Director Topier.
Thank you to both Dr. Phillip and Director Fosdahl. We all appreciate the support that your teams offer in ensuring businesses both know and are following the rules that keep us moving forward. DPH has been a phenomenal partner. I really want to let everyone know that. And I thank you both for your genuine interest and responsiveness to the needs of the business community and the economic health of our city. Also, as Dr. Phillip mentioned, I do want to reiterate that because this is a preview to reopening, it is always possible that things might change. So please check the health order to confirm the rules that guide your sector. And now we will turn it over to all of you, our participants, to ask your remaining questions. We have several representatives on the call that can answer questions about the support programs available to businesses. We have OEWDs, Diana Ponce de Leon, who can speak about resources and support. Robin Abad, Director of the Shared Spaces Program, who can answer questions you may have about shared spaces. And finally, Maggie Weiland, Director of the Entertainment Commission and the city's CERT team, who can address health order education efforts. Please send your questions to Q&A through the chat function. We will get through as many as we can. If we do not answer your question today, please email them to marianne.thompson@sfgov.org. And if you are a member of the press, please send your inquiries to dempress@sfgov.org. We have several questions coming through, so I will get started. I have questions so far for both Dr. Phillip and Director Fosdahl. So a lot of questions, I think, coming through, looking for clarification between the city and the state. So I will start with some of those for Dr. Phillip. Can we get clarification on the state website saying that in yellow tier, dining is allowed at 75% capacity if everyone, guests and workers, are fully vaccinated? Will San Francisco consider this?
Yes, thank you. This was a new addition to the state, and so we're looking at that requirement, what it would mean. We have heard from businesses, from restaurants, that they would want us, DPH, and the city to provide more guidance around what it means to ensure full vaccination of patrons in order to increase capacity. So I realize that it's a vital interest to increase that capacity and have more patrons. So we're not going to make that change initially in yellow tier, but we will be looking at that with the goal of trying to align with that as soon as we have more information and are able to do that safely.
Thank you. I have a question about singing. And will the distancing requirement for singing be reduced from the 12 feet required now?
Yes, we are anticipating that just as we have reduced the distance indoors for activities like fitness classes and gyms, that singing will also be reduced with face coverings on at all times for all of these indoor activities to 6 feet is what we anticipate.
I have a question about summer programs. I don't know that I'm quite, this is, will the criteria for summer programs be loosened to allow only 2 weeks instead of the required 3 weeks presently?
Yes, this really has to do with some of our childcare programs, our camps, and sports programs. So there is a youth sports town hall that'll be happening later today. So we'll be talking more about that then. But to answer briefly, we are maintaining our 3-week cohort. And that is because that among children, particularly who cannot yet be vaccinated, remember, vaccines are not yet approved for anyone under 16. One of the key ways that we prevent transmission and keep children safer is by keeping them in the same groups for a period of time. So we are going to continue that for the time being. We understand that there are some challenges with that, and we continue to evaluate how much longer it might be needed.
Thank you. Another question. CDC said this week that fully vaccinated people indoors around exclusively fully vaccinated others can go without masks. Does this mean if our workplace is 100% fully vaccinated employees, we can go without masks in the office?
You know, I think that is a great question. I think we are in a period of transition and change, and the CDC is changing some of its guidance, and the state is changing some of its guidance, but it hasn't all been changed yet. And this is one good example of this. Cal OSHA, which controls workplaces for most of us and says what is required for protection of employees, still requires distancing and masking, even though people are vaccinated in workplaces. So look to changes in this over the coming weeks, and we will certainly, with our partners at OEWD, make sure that any updates get sent out to the groups and to the public if this were to change.
Thank you. I have a couple questions for Patrick, and starting with how far in advance do plans need to be submitted to DPH if required for events, artist residency, higher education programs, et cetera?
Yeah, typically we get those plans with 2 weeks, at least 2 weeks notice. I think we have, and correct me if I'm wrong here, Dr. Phillip, but I think it was added that an additional week. So it's now 3 weeks advance notice of those events.
And some of these will depend on whether an approval is needed ahead of time. And for some of the events that are not quite as large or don't involve food permits, for instance, it might be possible to have a shorter lead time. So this is one of those areas where I'd say the sector that you're interested in, please make sure to go and look at the final order, directives, and any guidance that comes out. And then we're happy to answer any questions that come after you take a look at those materials.
I also, this is, I think, for either for Director Fosdal or for Director Maggie Weiland. Is it possible to talk to someone from DPH or from the entertainment team about potential events before submitting a formal plan to DPH so we can make sure we are taking all of the correct steps?
Yeah, I can tell you from DPH's perspective, absolutely. And we would love to spend that time. As I said, anything we can do to make things operate more safely and in compliance with the health order, we'd much rather do that in advance, and happy to spend as much time as you need to make sure that you've got that properly prepared ahead of time. And I'm sure the Entertainment Commission feels the same way. Maggie, you want to weigh in?
Hey, Patrick, I love that we're in the four squares now. Please, go ahead and feel free to email the Entertainment Commission with any ideas of events, and we can vet those with you along with health order rules. We're at entertainment.commission@sfgov.org, and we keep our JAM permit website updated when the health order rules change, and that's at sf.gov/jam. I'll put both of those in the chat.
Thank you. I have one more for you, Patrick, and then I have a quick one for Robin before we close out. But for Patrick, this question is, I read recently that the limitation on indoor worship in the state of California has been removed by Governor Newsom. How does that change the enforcement concerns you just mentioned?
Yeah, and I think that's actually also a question probably for Dr. Phillip. She outlined some changes around that as they apply here in San Francisco. And what we're going to follow is exactly what is outlined in the health orders here in San Francisco. And when San Francisco says 100% capacity, then that's where we'll be. And I don't know, Dr. Phillip, did you want to add anything to that?
I do. Thank you so much, Director Fosdal, for that. I think that, well, in San Francisco, what we have done consistently is that we have made sure that we are no less or no more restrictive on indoor worship or political protest indoors than on any other sector. So right now we're at 50% capacity for indoor worship, and that is the same as we have for retail and for dining and for all the other indoor activities. So that is where we are now as a city. And with spacing, that is often ends up being the limits as to what a building can hold safely with COVID precautions and COVID safety for its occupants in mind.
Thank you. And then I'm going to try and squeeze one more quick question in. Thank you, Robin Abad, for joining us. This question is, our shared space permit is set to expire on June 30th. Will they be extended?
Thank you, Director Topier. This is Robin Abad, Director of the San Francisco Shared Spaces Program. The answer is yes. As we approach the end of the expiration period for current shared spaces permits, city departments are working to figure out a sensible extension period to allow folks to continue operating as we anticipate a more permanent version of the program to be legislated and new provisions to be put in place. So please stay tuned for more messaging from our team. We're not going to leave you hanging, and we should have more details within the next few weeks.
Thank you, Robin. So it is time to close out, and I do want to just thank everyone, all of our panelists today, Dr. Phillip, Director Fosdal, Maggie, and Robin. Thank you for being here. And I really want to also extend a heartfelt thanks to our participants for your time, your questions, and again, for your ongoing partnership and patience. And as a reminder, if you have any questions that we weren't able to get to, please visit our website, OEWD.org, or email marianne.thompson@sfgov.org. We look forward to reopening and seeing you soon. Thank you so much.
Thank you once again for joining today's best practices for reopening and preparing for yellow tier. And as mentioned before, again, for more information, please do contact marianne.thompson@sfgov.org. Thanks so much, everyone. Have a great evening.